When you're in your senior years of life, it's normal to be dealing with more health issues. And unfortunately, this means you're likely taking more medications. And with that comes some potential problems. You want to make sure you're taking the right medications for the right reasons, and that's not always easy to do. And there are many reasons why people end up making mistakes. In this video, we'll tell you 12 medication mistakes that seniors make. So if you're a senior citizen or you're caring for one, keep watching, because by the end of the video, you won't be doing any of these things. Let's get started. Taking medication that has been prescribed to someone else. One of the worst things you could do is take medication that was prescribed to somebody else. This is actually a big problem in America and other countries around the world. It's estimated that every year millions of Americans take prescription drugs that were meant for someone else. And this can happen because a lot of medications look alike and also sound alike. For example, the drug Lamictal sounds like the drug Levaquin, which are two completely different drugs used for two completely different purposes. Or take the drugs Klonopin and Chlorospate. They both start with the letter C and end in the letters CL and have very similar sounding names, but they're not the same. You might remember we made a video about the dangers of taking someone else's prescription drugs. If you haven't seen this video, make sure to check it out after this one. The reason this happens a lot with seniors is because most of them do unused technology, and that is how most people verify their prescriptions. But there's a much better way. Any trusted family member or caregiver should know all the medications that the senior takes. That way, if they pick up a bottle from the medicine cabinet and are unsure what it is, they can easily check and make sure they aren't taking the wrong medication. Not telling your doctor about supplements you're taking. Many seniors choose to take dietary supplements to help improve their overall health. These can include vitamins, minerals, botanical herbs, and many other types of supplements. The problem is that many seniors don't tell their doctors what supplements they're taking. This could be for many reasons, such as the senior doesn't think it's a big deal, they feel embarrassed, or they simply forgot. But whatever the reason, this is a big mistake. Some supplements can interact with prescription medications, either lowering the effectiveness of the medication or increasing its side effects. For example, did you know that taking garlic supplements can increase the risk of bleeding when taking blood-thinning medications like Plavix or warfarin? Or that taking St. John's wort can cause you to have a serotonin syndrome when taking Zoloft? These are just two examples, and there are many others. That's why it is important for seniors to make a list of all the supplements they're retaking and then go over it with their doctors. Also, ask your pharmacist about any interactions that may occur between supplements and prescription drugs. Not disposing of old medications properly. According to the American Pharmaceutical Association, 1 out of 5 people in the United States still keep old medications laying around. This can be dangerous because it can lead to accidental poisoning, medication overuse, and medication abuse. A study published in the Journal of the American Medical Association found that nearly half of Americans had an expired prescription medication in their medicine cabinet at home. So what should you do with those old medications? The FDA suggests that you do one of 3 things. You can pour the medications down the drain, flush them down the toilet, or throw them in the trash. However, there are certain medications that should not be disposed of this way. These include medications that contain controlled substances. This category includes drugs like Adderall, oxycodone, Xanax, and many others. Check online to see if your medications need to be handled differently. Not knowing how to properly store medications. It's common for seniors to make the mistake of not storing their medications properly. This can lead to decreased effectiveness of the medication, or even make it dangerous to take. Are a few tips on how to properly store medications. Follow the instructions on the label. If there's anything you don't understand, ask your pharmacist. Don't store medications near heat sources such as radiators or behind fireplaces. Also, you should never store medications in the bathroom unless it's a waterproof container. Moisture can cause some medications to spoil or become less effective. Finally, don't keep medications in your car. Temperature inside a vehicle can change drastically throughout the day, which can affect some medications. Taking too many pills. Taking too many pills is another mistake that seniors make. Most seniors want to take care of their bodies, and as a result, they take a ton of different pills, thinking that it will improve their health. While this might seem like a good idea, the truth is that taking too many pills can actually do more harm than good. As you get older, your body changes. It becomes less efficient at absorbing nutrients, and also becomes more sensitive to medications. This means that taking multiple medications can increase the risk of side effects and can lower the effectiveness of the medication. Plus, the more pills you take, the greater the chances that you'll make a mistake. You could accidentally take the wrong dose or skip doses, or maybe even take the wrong pill. In fact, studies show that about half of all hospital admissions for people over the age of 65 involve a medication mistake. Hoarding medications. Another mistake that some seniors make is hoarding medications. This is where they hold on to old medications, either prescription or over-the-counter, for no apparent reason. Maybe they took the medication years ago and didn't want to throw it away, or maybe they have a family member who has the same condition and they re-saving the medication for them. Whatever the reason, hoarding medications is a big mistake. Not only can it lead to accidental poisoning or medication overuse, but it can also lead to dependency. For example, let's say a senior has an extra bottle of Valium that they've been holding on to. They might start taking it when they're feeling anxious or stressed, but since it's not prescribed to them anymore, their body might build up a tolerance and they could end up becoming dependent on it, not asking questions. Asking questions is one of the best ways to avoid making medication mistakes. But surprisingly, many seniors don't do it. They might be afraid to bother their doctor, or maybe they feel embarrassed asking questions. But whatever the reason, this is a big mistake. You should always ask your doctor or pharmacist any questions you have about your medications. And here are a few examples of questions you should definitely be asking. What is the name of the medication, and what does it do? How should I take the medication? For example, should I take it with food or on an empty stomach? How long will it take for the medication to work? And what should I do if I miss a dose? Ignoring side effects. Ignoring side effects is another mistake that many seniors make. They might think that the benefits of the medication outweigh the risks, or maybe they just do want to know what to do about the side effects. Whatever the reason, this is a big mistake. You should always talk to your doctor if you experience any side effects while taking a medication. There are many things your doctor can do to help, such as lowering your dose or switching you to a different medication. So don't suffer in silence. Talk to your doctor if you experience any side effects. Mixing alcohol with medications. Mixing alcohol with medications is another mistake that seniors make. Alcohol can interact with prescription medications, causing dangerous side effects. And while a little bit of alcohol might not seem like a big deal, it can have serious consequences. Here are just a few examples. Alcohol can increase the drowsiness side effect of some medications, making it dangerous to drive or operate heavy machinery. Alcohol can also lower the effectiveness of some medications, meaning that they won't work as well. And finally, mixing alcohol and medications can cause liver damage. So if you're a senior or taking care of a senior, make sure to avoid mixing alcohol with medications. Stopping medications abruptly. Stopping medications abruptly is a big mistake that seniors make. This can be dangerous and lead to withdrawal symptoms. It's important to note that not all medications can be stopped abruptly. Some of them require you to taper off slowly. That means decreasing the dose gradually over time. So never stop taking a medication without first talking to your doctor. If you want to stop taking a medication, your doctor might suggest tapering off slowly. Taking medications that haven't been approved by the FDA. Lastly, taking medications that haven't been approved by the FDA is a big mistake that seniors make. Many seniors turn to alternative medicine to treat their conditions. And while there's nothing wrong with that, it's important to be careful. Just because something is labeled as natural doesn't mean that it's safe or effective. In fact, some natural supplements have been found to contain harmful ingredients or have interactions with prescription medications. That's why it's important to talk to your doctor before taking any medications that haven't been approved by the FDA. They can help you decide if the risks are worth the potential benefits. Remember, you don't have to suffer through aches, pains, and other ailments. There are safe and effective ways to manage your pain. As always, stay safe out there.